Many of you know her because she is a graduate of USC. In 2014, she graduated with her PhD in clinical and community psychology, and then she did a postdoc that was in the Department of Psychology as well as in Tech Health. And in fact, what she's going to talk about today is something that is an outgrowth of some of the things she did when she was a postdoctoral fellow at Tech Health. And for those who know her, I asked her, well, what's something that the folks who are here who know her won't know about her? Because after all, it's always good to learn new things about your speaker, and her interest in using technology in entrepreneurial and creative ways goes way back. As an undergraduate, she actually funded a trip for herself to go to Australia by buying designer clothes on eBay and sprucing them up and flipping them at a profit. That was enough to get her all the way over to Australia. So obviously she's been using some of these technologies to her advantage over the years. So right now she is at the Ralph H. Johnson, I had to look to make sure, VA Center, which is down in Charleston, where she's a psychologist in primary care and mental health. And we are delighted to have her today to talk about stress management apps. And take it away. Thank you so much for joining us.
Yeah, thank you so much. I'm really excited to be here. It feels like it's been too long since I've been back to Columbia, and I'm glad to see some faces I know. And thank you for coming. So stress management, there's an app for that, which, has anybody not heard? I mean, you would have been under a rock if you've not heard that there's an app for that catchphrase, but I'm going to be presenting today on some work that I did with Delia and also with Courtney when I worked here as a postdoc. Thinking first about stress. There's a national survey that's done by the American Psychological Association every few years. And in 2014, they surveyed U.S. adults around the country asking about stress. And what they found was that rates of perceived stress are increasing, and that about 75% of adults would report themselves as feeling significantly stressed over any given month. 29% of adults in 2014 perceived that their stress had increased in the past year, whereas only 18% said that it had decreased, and about 42% believed that they could be more active in managing their stress. So a show of hands, and you may or may not want to be, I don't care if you want to be honest or not, but who would say that they have no stress right now? No one? It's the end of the semester, right? I thought about that, but I was like, yeah, perceived stress. Yeah. So let's just go with what they said, significantly stressed. Who would say they feel significantly stressed? Do we have a 75% in here? No? Very good. We can do moderate. But I wondered if in a group of exercise scientists and psychology folks, if you would be doing a little better. So maybe that's the case. You know how to manage your stress already. But stress has a high economic impact in the U.S. There are estimates that work-related stress alone costs the U.S. $300 to $402 billion annually. And to put this into context, the direct medical costs of obesity are around $147 billion in 2008 per the CDC statistics. So this is a growing and pervasive clinical challenge, and the issue of how stress impacts mental and physical health is being increasingly recognized as healthcare tries to move toward more integrated models of health. So Delia mentioned that I'm in primary care mental health at the VA, and this is one of the things that comes up all the time, is what is this connection between stress and chronic pain and depression and all the things that are very common in adults. So it can lead to conditions like obesity, hypertension, or at least contribute to them, as well as poor medical adherence. Just some additional info about stress. The top stressor over the last 10 years has been money, followed by work at a close second, and then family responsibilities and health concerns. That may not be much of a surprise, but would anyone, just curious, have guessed that something else was the top stressor for adults? Yeah, okay. So thinking about technology and how technology might be useful for managing stress, 68% of adults in the US owned a smartphone as of 2015, and of those owners, about 62% reported that they use their devices for health-related reasons. Also, rates of ownership are increasing in the populations that are more likely to have access barriers to traditional health care. And in some lower income populations, there's also reports that they use their mobile smartphones as their sole source of gathering web-based information. And then there's reports also that people actually want to be able to use mobile apps to manage, to take an active role in managing their health. Just as a reminder, so that in case this last 10 years have been such a whirlwind, maybe you forgot how far we've come in terms of technology. So here's Palm Pilot in 1996. Did anybody own any of these? Yeah, I had a Palm Pilot when I started working with Dawn. And so in a very short time period, especially since the introduction of the iPhone with a touch screen, and more, I guess, easily downloadable apps, in a very short time period, all of these opportunities have become available. So this is a very exponentially growing world to dive into. So as far as technology and stress management goes, 95% of patients surveyed about stress management have said that they believe using mobile apps would be helpful. And physicians have reported that while they also at about 90% think this would be helpful, most of them feel that they lack the resources to talk about these things with patients or directly deliver stress management interventions themselves. And of course they don't have time for this. They'd be spending physicians could not always serve this role. But despite the fact that this seems maybe like a no-brainer for people to go to use mobile apps for stress management, there are a lot of barriers to both providers and patients and just consumers being able to, one, know what types of strategies they should be looking for in a mobile app to help with stress. Two, being able to identify those apps through app searches. And then three, actually taking that plunge and deciding, okay, I've downloaded this app, now I'm going to invest my space on my device, my money, potentially if the app costs money, and my time and effort into trying this out. So, when we first started this, basically last year when I was working with Delia and Courtney, we had this idea and thought, okay, well we'll just search the App Store for stress management apps and see what happens. We'll do this review. It'll be, how hard could it be? When we did this search a year ago, it was in the 2000s. So you can see, I just searched for stress management. That seems reasonable, right? And yeah, it's almost, 3,400 results. And the first, I'm very familiar with Michael Quach. I don't know if that's how he's got an abundance of apps. But maybe looking at this first app, you can see that anti-stress quotes, exclamation point, stress relief and anxiety. And the screenshot says, the only pressure I'm under is the pressure I've put on myself. So anyway, probably not going to be the best intervention-related app just from looking at, but it's the first thing that pops up, and then a person has another 4,000 results to wade through after that. So that was a surprise to me too. So there's an app for that. And that, and there's many more apps than you would have thought for everything. There's a glut of apps, basically. And when you combine that with unsophisticated app search tools, if you've ever tried to search for an app on your phone or on your tablet, you may or may not have noticed that you can't sort the results. You can't refine the results. This is really the only platform where we're not able to do this and try and get through those 4,000 apps and get what we need. And then there's also issues of truth in advertising. So it's kind of like the wild, wild west out there. If people meet these basic, these very basic, more technology-oriented standards, the app gets published. So this concept is called app overload. And has anybody heard that term used before? I've seen it. You can see it some places in the scientific literature. But it's just the notion, the term used to capture this whole set of issues. So then on top of that, when people review apps, those reviews can be very helpful, but there's not any consistent structure for how apps are identified and reviewed and evaluated. So for the study that we did, our first aim was to identify mobile apps for evidence-based stress management strategies, to evaluate them, and to present them to the scientific community and to the practicing community. And then our second aim was to move a little bit, or expand really, beyond what we had seen being done in other app reviews. And basically what we saw in looking at app reviews was usually a focus on evidence-based content, which is really, so when researchers and scientists are looking at apps, the main focus has been on, are these apps providing efficacious strategies to help people achieve the outcome they say that they will? And that is the core of what people need to know for an app. So that was the first thing we looked at, but we also said, well, in looking through these search results, we're noticing some other potential problems with apps. And so one other potential problem is transparency, so whether or not the app developers have provided enough information and have provided enough detail and enough, I guess, reliable or honest information to allow a consumer to make an educated guess or to make an educated decision as to whether they want to download the app. So, and then the third issue was, well, if the app has good content and, we trust what the developers have said, they've given us enough information, we could still download the app and it might crash, it might not work because they haven't updated it since 2009. So then we have this third domain of usability and functionality that we were also interested in evaluating. Now the paper for this is out. This is the corrected proof. So I guess it's published electronically. And if you're interested in references, come talk to me after, or you can refer back to the paper. And I just thought this was interesting. But apparently we have 17 tweeters. Cool. I don't tweet yet, but that's pretty cool. So this was published in the American Journal of Preventive Medicine. So what did we do? First, we decided I'll just give an overview of our methods, and then I'll go into more detail. But first, we decided what evidence-based stress management strategies we wanted to target. Then we had to decide, okay, well, what tools are we going to search them on? Are we going to use a tablet? Are we going to use a smartphone? Are we going to use both iPhone and Android? And ultimately, we went with a smartphone because more adults own smartphones versus tablets, and we went with the iPhone operating system. And then we did when identifying apps to include in the evaluations, we did a 10% reliability check, and then 2 people downloaded and evaluated all of the apps that were included. We adhere to PRISMA guidelines for our review. The stress management strategies that we targeted, we identified based on the scientific literature and health books in textbooks in health psychology. And really the core of these, diaphragmatic breathing. So that's deep breathing with your stomach, meditation and mindfulness strategies, progressive muscle relaxation, using imagery and visualizations, cognitive restructuring for modifying thoughts that may be leading to higher levels of stress, problem solving to reduce stressors or their impact on a person, behavioral activation to get people doing things to balance out those stressors, and then building and using social supports, because that is a great strategy for managing stress. And then we searched the App Store. We did 21 different searches where we just combined the word stress with different forms of the word for each of the strategies that we identified. Now, because this process was not as simple as we initially thought it might be, we ended up coming up with a multiple level design for identifying which apps to include and then evaluating them from there. So first and foremost, we had to, out of 4,000 apps, or like I said, it was 2,000 something at the time, we had to get rid of the apps that just were not going to be at all relevant to our target population. So first, we excluded all apps that were not in English, that were targeted for children or teens, that were specific to anger management. There are a lot of anger management apps, and a lot of them I think would actually make a person angrier than help with. There's some odd, there's like a, well, you can look for it yourself, and but it's interesting. Apps that weren't a gateway or mediator to other products or services. So we also came across a lot of apps that were not really apps, but like bookstores. And because they had a lot of books on stress management in their store, that they would pop up. And apps that weren't coming up as duplicates. So once we got those out, and I'll show you the results, the numbers in a bit, we wanted to figure out a way to identify apps that were most likely to have evidence-based components in them, because this is a lot of apps to go through. We can't download, I mean, I guess we could have downloaded 900 apps, but, and so we selected out apps that had some term in the app description that was related to research or science or evidence. And so we then included those apps, or they either had to include a term like that, or they had to reference an established nonprofit institution like the VA, or there were a lot of various universities that had published apps too.
What's research about their place?
Probably a typo. But no, there's no...
I was wondering if you were doing something funny with the movie and I want to check that.
Yeah. No, but... Yeah. Yeah, that's actually... You cannot do that. Yeah. That would have been really nice, though. Mm-hmm. Yeah. And so then once we got those apps out, we said, okay, well, we still have likely a bunch of junk, and what we want is stress management intervention apps so that people can use them to make changes. And when you make changes, in order to make a change, you need to have some kind of skill-building component or behavior change component like self-monitoring. And we also said, well, and of course we're targeting stress management, so they need to report that they are providing at least one of the stress management strategies we've identified. Okay, so after all that, we finally got our group of selected apps, and we downloaded them, and then we evaluated them across the 3 domains of content, transparency, and usability. So just some miscellaneous things related to this theme of things being a little more complicated than at least I initially thought they would be. For one of the searches, we truncated it to 200 results because it gave us like 700 results, and many of them were redundant. We decided not to include directly quoted feedback that was in the description. So for example, you might see apps where people had quoted medical professionals or quoted user feedback in their descriptions, but we didn't consider that part of the description because it wasn't information that the app developer would have provided. We made sure that we explored all the menus in each app when we evaluated them, and we watched the first 5 minutes of the first 2 exercises in any of the apps. So for example, an app providing meditation strategies might have had like 40 tracks on it. So we did not listen to all 40 tracks. And we used them for 1 to 3 days depending on what they required for their different features to emerge. If a free app offered a paid version, we downloaded the paid version if there was some specifier as to what additional features the paid version included. So just to give you a little more idea of what app transparency is anybody already familiar with the Health on the Net guidelines? Okay. They have 8 guidelines, and we made some slight changes just to fit the app platform because Health on the Net guidelines are made for the internet. And that includes these 8 things: authoritative, whether or not the app states the qualifications of the developers, degrees, training, that kind of thing. Whether that basically a disclaimer that apps do not provide medical care and are not a substitute for medical care. That's very important. Confidentiality and privacy information. We also wanted to know, do apps provide references and for the claims that they're making that their strategies for stress management will actually help? Do they describe that to the consumers? Do they provide contact information, funding information, and do they make it clear when they're advertising something to you versus delivering you meaningful content? So for usability and functionality, this was a little less, there's not as much of a standard for this. So basically we looked through the literature and saw what kinds of things other app reviews had looked at, and looked through some of the more technology-based literature on what they evaluate in the app development world. And so we wanted to know, is the app easy enough to use? Is it reliable? Will things actually load within 10 seconds, meaning people will use the app, or will the app crash every time you try to click on the first meditation track? Is there anything crazy going on with the appearance? So, for example, some apps might not have been readable because they had dark purple text on a black background or something. And is the app storage size reasonable? Now, because these are so subjective, we just evaluated whether or not there were any obvious problems with these. So the results of what we did, we identified 902 apps initially, and 291 were first excluded just because they weren't going to reach our basic target audience due to not being in English, being for children, those kinds of things. And then another 506 were excluded for not either having some kind of evidence-based terminology in them or citing the involvement of a nonprofit research-engaged institution. And then we excluded an additional 43 because they indicated they didn't indicate that there was going to be any behavior change strategy or skill building involved. What we ultimately ended up with was 60 apps that we downloaded. By the time we went through all this process, there were 2 that were no longer even available. So, okay. So what did we find? Out of the 60 apps that we reviewed, a full 20 of them, so 33%, did not actually include the stress management strategy that they said they included. And this was due often to improper instruction of the strategy. So for example, with diaphragmatic breathing, they would say they use stress management breathing. Well, with breathing for stress management, the idea is that you're breathing with your diaphragm in order to counter the stress response that is indicative of breathing heavily with your chest. So those apps might have said something like, breathe very deeply with your chest, which is not diaphragmatic breathing. It's not the diaphragm. And it could be also that they delivered a different strategy than stated in the description that was not one of the ones we were targeting. And then some of them just didn't work. So they would crash when we tried to investigate them. And so 40 actually did deliver an evidence-based strategy. Of these, the majority, 68%, included a single strategy. And the rest included 2 to 4 strategies. The most common strategies, well, I guess, what would you think would be most common? You probably saw it, didn't you? Yeah. Yeah, so because that's easy, right? You just stick a track on there with some music, and there you go. You got a meditation app. So mindfulness and meditation were most common. 73% of the apps delivered those strategies. Next were diaphragmatic breathing and apps for seeking social support. Then there were some apps that had guided imagery and visualization. And then the apps with the lowest frequency for stress management were the ones that were more cognitive. So problem solving and cognitive restructuring apps. And then apps that were purely related to coping and behavioral activation were also not that common either. Now, so that was domain 1. So domain 2 for app transparency. Most of the apps did an okay job with this. Remember, there were 8 transparency criteria, and on average, apps met almost 5 out of 8. And only 1 app didn't meet any of the criteria, but only 12% met all 8 criteria. And so the contact information, sort of the basic ones, were more common. But what is more alarming from a scientific standpoint is just that the biggest deficit in apps in terms of transparency was that only 30% provided references for people to refer back to as to why that strategy is evidence-based and why it matters. 60% did, however, provide some explanation of the scientific basis for the strategy that they were delivering, which is, I think, pretty good. To give you an example of how these, because I think the transparency realm and all these 8 criteria are a little bit more nebulous until you actually see them in an app. This shows 8 screenshots from 8 different apps, with each screenshot demonstrating a different app criterion. So, for example, with the references, this app right here, it's the Moving Forward app, and they reference this problem-solving therapy treatment manual that was published by Springer Publishing Company in 2013. So that's kind of the ideal that we'd be looking for, that it sort of looks legitimate. But you're right, somebody could self-publish their own book of personal beliefs. And yeah, so I know that this print is probably too small for you to read, but that's an illustration of the one criterion that was brought up. And then, for example, this one's maybe bigger to read. This app here, this is the Headspace app, and it's just an example of a very clear advertising policy, where when you navigate to that screen, you know they're trying to sell you something. They're not trying to mix in intervention to trick you into, 85% of the apps were deemed acceptable as far as their appearance, ease of use, and reliability and performance. And so again, with this domain, that was just that there were no obvious problems because it's so subjective. 95% were acceptable for appearance and design. And then the thing that actually did vary a lot was app storage size, which if you've got a phone with a lot of space, you may not care about. But I know as I was doing this really mattered to me because I was like constantly deleting apps and having to manage what took up what amount of megabytes. But anyway, so the mean app size for stress management was about 61 megabytes. To put some of this into context, Google Maps requires 71, and Facebook requires 170. The highest number of megabytes required by an app was 396, which is almost double the size of the Facebook apps. And it was not it did not provide a lot of content. I think it was just meditation maybe. But anyway, so lots of range between efficient and clunky. So all in all, as far as what we included in the publication, the apps that we presented, because remember, one of our aims was not just to do this evaluation, but to present apps that providers and consumers and people might use. So we said, as long as an app has a stress management, evidence-based stress management strategy and has no problems with user functionality, we'll list it out and let people make their own judgments. There were 32 of these, and that's about 53% of the 60. We ultimately decided not to make any determinations based on transparency because it was sort of a new realm, and it's like, well, where would we require, what level of adherence to those 8 criteria would we require in order to give our stamp of approval? And we couldn't really come up with a good reason for that or any evidence-based reason why, addressing at least 4 out of the 8 would be more important than 2. So anyway, this is just the first half of the list of the apps. Does anybody use an app for stress management? That's probably one of the first questions I should have asked. No, not yet. Yeah, yeah. So we've just got a lot of, this is sort of how I'll flip through it. If anybody sees any that they know or are curious about, ask. So one of the things that we looked at was what the apps from the nonprofit research engaged institutions look like. And we found that 23% of all the 60 apps evaluated were from an institution like that, and 31% of these, 31% of the 32 apps that had a stress management strategy and no issues with usability were from one of these places. Now, it's interesting, I think, more so is that 71% of the apps affiliated with one of these places met our threshold for having a strategy and being user-friendly. And that 71% is a lot higher than, I think it was, 53? Yeah, 53% overall. So these places are doing a better job of this. Now, of the 32 apps that we ultimately presented, 59% could be downloaded for free, which is great. The cost of the remaining apps were $1 to $10. And of the 28 apps that did not have any stress management strategy, so remember, these were the ones we didn't like because we went through all this type of weeding out to get rid of you, and yet we downloaded you and you're not giving us what you said. 46% of those could be downloaded for free. So actually the apps that were that didn't have anything useful were more likely to have a cost associated with them. The cost of the remaining apps were as high as $15. Again, that's of the ones that didn't have any useful stress management strategies. Let me see. So just a quick, this is one of the apps called Centered. So you can see it actually combines, it's happening quickly, but it has an activity component, stress self-monitoring ratings, pretty easy, smiley face, . 'Cause, 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 Okay, so just to wrap up or come to some conclusions, there were 32 apps that we found that could potentially be useful. Now, again, these really varied, and this is more anecdotal, a little maybe more of a personal opinion, but these really varied in terms of the quality still. The majority focused on mindfulness and meditation strategies, so you're really more limited if you prefer to try or incorporate some cognitive strategies into your stress management, so problem solving, that kind of thing. And with transparency, things weren't too bad. We set a kind of not a too high bar, but only 12% really addressed all of these things when it's not that difficult to do. Apps could do this if that standard were in place. And there are generally few major obvious issues with ease of use and reliability, though as we discussed, there's a lot of room for growth and for understanding how not just not doing badly in that domain, but doing very well in that domain could make a difference and make people more likely to engage with an app for consistent long-term behavior change. So, but again, 33% of the apps, even after our tedious process of trying to weed them out, did not deliver a stress management strategy. And another researcher who had published an app review when we were doing this, put in their discussion, in reality, the purpose of the description of an app, which is what we have to base our assessment on when we're deciding whether or not to download, is just to convince a person to download the app and pay for it if it's not free. Has anybody gotten a refund for an app before? You can do that. You can apply for it. I didn't go through the trouble, but I think that speaks to why this is so true, especially for apps, because people aren't going to request a refund for something they paid $1 for. And ideally, we'd want to say, okay, well, it's got a lot of 5-star ratings, yay, but those metrics can be inflated. There are a lot of ways that people can, you'll hear of big app developers hiring people to go in and rate their apps for them. And the star ratings in iTunes, a study recently came out showing it's only moderately correlated with app quality that was objectively measured for this particular study. However, it's not too dismal, because one of the benefits of mobile apps is that these corrections can be made and disseminated more quickly than, say, if there's a big blunder in an intervention that's being delivered in a more traditional way or in a more tangible healthcare. So the irony is just that, while I have this quote from Steve Jobs where he says, quality is much better than quantity. One home run is better than 2 doubles. With the app world, this is in no way, shape, or form being lived up to, because quantity, as you saw with all those numbers, makes it nearly impossible for someone who's just like waiting in line at the grocery store to scroll through and identify a stress management app that is going to be a good fit for them and going to be possibly effective. So how does this apply at a practical level? I mean, we can't expect consumers to do what we did, We can't expect them to conduct these rigorous reviews before selecting apps. So there's not a great answer for this, but for the time being, until possibly Apple and Android get a clue and make their search features a little bit more robust. Until then, people can look for descriptions that include terminology related to evidence-based content. So looking for words like evidence, research, science, that kind of stuff. The risk with that, though, is that anytime something gets used frequently, it becomes a buzzword. People pick up on that and will use it accordingly, regardless of whether it's relevant for the app. And then also people can look for apps that reference the developing team and their backgrounds as at least some kind of gross measure of transparency. So we saw, there are a lot of apps that say This was developed by a life coach, so sort of very vague information about the developers. And whereas if you see something that's a little more specific, that's probably a better sign. So some benefits, just that mobile apps can provide real-time support for people in changing circumstances, and people can really pick an app and an intervention that resonates with them versus a one-size-fits-all option that they might get elsewhere. And then this is maybe more of something that is personally important to me, but I think that using apps for stress management, and because apps are so pervasive and widely used in an acceptable way to manage your health with not really stigma attached, I think that using apps for these basic life skills like stress management can help to promote behavioral medicine and taking care of our mental well-being and all of those important things in a society that I think is still very biomedical, where people may see a stigma to going to meet with a counselor or psychologist for stress management, but they're okay with using an app and getting introduced to things that way. So our findings are limited, though, just to the iOS operating system and the iPhone, and we didn't capture the full spectrum of stress management strategies. So this is, preliminary. And just some things that I've been thinking about as far as future innovation go. I'm going to go through these really quickly so that we have at least 8 minutes for questions. But I like the Centered app that I showed because it integrated self-monitoring of physical activity with self-monitoring of stress. So apps that integrate these different health behaviors with stress management, I think could be really strong tools for living well. We also might see in the future more tailored apps. So this is something Delia has talked about in the past, like can an app tailor the different intervention components based on what a person clicks and looks at and does and doesn't, and it gets more complicated than that, but that's the idea. Or for example, if a person seems to prefer cognitive strategies over behavioral or purely behavioral, or if an app is values-based, meaning that it allows the person to assess their values and then adopt appropriate stress management strategies. And then we know what the top stressors are. So we know it's like money and work and all these things. So can we integrate stress management strategies or examples that target these things? And then there's just so much opportunity for making the actual structures of the mobile app more based in theory for behavior change. So certain types of reinforcers for using those strategies are using different theories for motivation for long-term change. And I think that's where I want to end. Thank you so much. Questions? I'm not sure, because I know that, I don't know how long ago, but within the past 10 years, I was aware that there was some research being conducted with post-traumatic stress disorder patients using virtual reality for treatment, because one of the main strategies for treating that type of disorder is exposure to the stressful event that triggered the symptoms in the first place. But that's really all that I've heard about that. But I think as far as stress management goes, some of the strategies more obviously lend themselves to doing that, like visualization and guided imagery. But whether or not virtual reality adds something to just doing it in your head, I think that research would have to be done first. And I don't know that it has with stress management, but I think for other, certainly there are other mental health presentations that probably could benefit from that, yeah. I know that with the iPhone, they do have, believe it or not, more rigorous standards for releasing apps, but I think that that's mostly dependent on the technological facets of the app, but it's also some legal stuff too. So in that sense, bias just in that we were more likely to probably get higher quality apps to review in the first place. And actually, bias in that I think we went back and in the publication identified which of the apps in that big table that I showed were also available on the Android platform. And I believe it was around 50%. So there's bias in terms of what we discovered, but also bias certainly in terms of generalizability, that a lot of these are not available unless you have an iPhone. You know, and I'm not sure, not being in the developer world, I don't know what the culture of developing in each of those, on each of those platforms is. I know like some are faster. And I know with the VA apps, they develop them all in the iPhone platform. But like you said, I think most of their patients use Androids. You know, I don't see a lot of iPhones. And they ran out of money, basically, to do it in Android. Yeah. There's some companies that will pull all that data for you and just give it to you. It's very expensive, and they were all very hard to get in touch with. I think it's a lot of like 4 people startups or something. Again, with just the stigma that some people associate with needing to manage your mental health at all. You know, with stress management is a form of doing that. Yeah, if tying it to tracking your walking and all that other stuff. And of course, they're all linked anyway, so. There have been a number of efforts to centralize that information, and to be honest, like it's not clear which one to go to. You know, so you can get the Health on the Net certification, you can get Haptique, that's one of them. You know, the CDC or those institutions might represent apps. So I think those would be useful. We didn't do it for this review because we were focusing on just the searches of commercially available stuff. But even if we had focused on that, it's hard to know, one, which one should you go to, and then 2, are they keeping up with it? Is the fact that they have a higher standard excluding apps that could be useful, where the developers say, well, we don't need this, people aren't using it, so why are we going to go through the trouble? I mean, I think it's still, like I said, and like Delia pointed out, the wild, wild west in terms of just regulating this kind of stuff. But there have been efforts. But I think one of Haptique, one of them got into like legal trouble too, so it's unclear. Mm-hmm. That's a really good question, because it speaks to the point that there's a lot of variability in how these criteria could be met. So an app could provide scientific information in like 4 sentences, or they could have multiple screens of really rich diagrams of how the stress response works and this and that. So with that question, with the actual references, usually what we saw was we didn't, count really if a reference was a link to a website. It had to be some kind of published document that, you know, said the title, the year, the journal or the book, whatever. Oh, they make crazy claims. I should have taken some screenshots of some of the descriptions. They make a disclaimer.
Yeah, okay, that's something.
The disclaimer will say this is not a substitute. Yeah. There's reimbursement for behavioral health counseling, so I believe it's not at the level of reimbursement that you would get if there's a diagnosis, like a mental health diagnosis of depression or a health diagnosis of chronic pain. But I know that at least in the VA system, you can code for behavioral health counseling that's independent of any. Yeah, but I'm not sure about private insurance. That's a great question.
Folks who would like to ask more questions of Sandra, please come up. And for the rest of you, thank you for joining us. Again, final.
Yeah, thank you.